I want to share with you the role of hysteroscopy in embryo evaluation and avoidance of blunt curettage in the management of missed abortion below 6 weeks. We all know that 20% of missed abortions are usually recognized in the early trimester, and most of them are because of chromosomal abnormalities. So we use embryoscopy to evaluate the uterus, the embryo for morphological abnormalities, and also to help us to avoid blunt curettage that is associated with a number of complications, including Asherman syndrome. That table helps you to look at the benefits of hysteroscopy versus routine instrumental evaluation, what we call D and C. We want to go away from D and C to D and visually look and evaluate. This video will demonstrate the steps for embryoscopic evaluation of a 7-week spontaneous missed abortion and hysteroscopic evaluation of the products of conception. We shall also illustrate the technique and highlight its advantages in improving the complications associated with the evaluation of missed abortions. We used the usual diagnostic scope with pressures of about 100 millimeters of mercury to distend the uterus. And you can, of course, during pregnancy, you want to use low pressures to avoid extravasation. Then you can clearly visualize the sac or the gestational sac, and using a hysteroscopic grasper, you can puncture the sac. Then you get your scope in, a 4 millimeter scope or less in diameter, and this will help you to visualize the embryo. You'll notice that you can have the complete morphological evaluation of the embryo with this good magnification, and you can, if you have any abnormalities, they can clearly be seen. Then with a clean grasper, you can easily pick the embryo out of the sac. For both morphological evaluation and cytogenic evaluation, to look for the causes of fetal demise. At the same time, using this method, you can carry out a directed visual evaluation of the products of conception without having to do blunt curettage of the uterus that is associated with the complications of infertility due to Asherman syndrome. So here we use a cold loop of a resectoscope, and that can help you to do the focused and directed evaluation without the use of energy. Then the products can be analyzed, and it's common that trisomy 15 is one of the common causes of these missed abortion in the first trimester. The benefit is that you do not have maternal admixture of the content, so evaluation is more well guided with this method. As you can see in conclusion, it is clear that hysteroscopy has a role to play in the evaluation of missed abortions, especially below 6 weeks, both morphological and cytogenetic evaluation. And it also helps us to avoid complications associated with blunt curettage, like synechia. Here you have a case we managed at our center of a lady who presented with total Asherman syndrome with closure of the uterine cavity as secondary to a previous evacuation of missed abortion. And you can clearly see that when you put in a scope, there is total closure of the cavity right from the internal os. So we used scissor dissection. It is usually preferred that you use a scissor dissection or scissor excision, and try to avoid energy in the treatment of Asherman syndrome. You need a very good image, because the risk of perforation is usually high. The technique is that you start from the internal os and you gently excise the adhesion. It's usually much better and comfortable to start from the peripheral to the central. The distension pressures of the uterus can range between 100 to 200, and slowly you begin to create a cavity. Proper scissor manipulation is quite important in the management of synechia. Otherwise, if you do not technically use the scissor correctly, it is very common that you are going to end up with a perforation. And how do we know you've perforated? Most times you have collapse of the cavity, and then it becomes exceedingly more difficult for you to distend the uterine cavity. Or sometimes you can even see bowel through the serosa of the fundus of the uterus. So care has to be taken while doing this. Sometimes some surgeons would use laparoscopy, guided excision of the synechia, to avoid the risk of perforation. You can see we nearly have a cavity recreated in this patient, but you can also clearly see that there was aggressive evacuation caused excessive fibrosis with endometritis, and recovering this endometrium is not very easy. Sometimes you need to do repeated surgeries to take care of the recurrences. We put a Foley balloon for about 10 days in this patient, and we manage them with cyclic progesterone and estrogen. Of course, we need to have a second look hysteroscopy after about 2 months. What is the take home? The take home is that we need to embrace the hysteroscopy in the management of missed abortions to avoid blunt uterine curettage and subsequent synechia. Thank you very much. Hope you enjoyed this video.